Hi guys, welcome to 6 worst ways of taking medications. So tip number 1, not taking the medications at all. Okay. So the second worst way of taking medications is by taking them lying down or lying down immediately after taking a medication. So tablets and capsules that stay in the esophagus can release chemicals that can irritate the esophagus and cause ulcers, bleeding, perforations, and narrowing of the esophagus. Also, lying down immediately after taking a medication is a no, especially for some regimens such as antibiotics. Like sometimes you're supposed to take them every 6 hours or every 4 hours. That means that you might have to take them even at dawn when you're sleeping. So for something like that, after taking the medication, wait for about 10 to 30 minutes before lying down. Yes, it might interrupt your sleep, but then that means that you also get a full benefit of the medication. The 10 minutes, 30 minutes, depending on how good you swallow and also your age. So the third worst way of taking a medication is taking it without water. I don't know how you do it, but aside from the fact that it's really audacious, it is also very wrong and a bad way of taking medication. This is because drinking water helps with the transit of medications from your mouth into your intestines, where it's going to be absorbed for you to use. So if you take it without water, it is stuck in your throat, or it takes a very long time to move from your mouth through your esophagus into your small intestines, where it's going to be absorbed. That means that you're going to have a delayed effect of the medication. That is why you might take paracetamol, and instead of having an effect like 30 minutes later, you might have the effect or benefit of the medication like 2 hours later. Mind you, the mouth doesn't salivate in the presence of medication. It only does that in the presence of food. So that means you don't really have a lubricating system to help you take in the medication and travel all the way to your stomach and your intestines for it to be absorbed. Okay, so that means you're also going to have a delayed benefit of the medication. Secondly, there's some drugs like anti-inflammatory drugs such as diclofenac, ibuprofen, and also antibiotics such as clindamycin. If you are taking them without water, especially over a long period of time, it can lead to something called pill esophagitis. It's a painful inflammatory condition where the linings of your esophagus is inflamed. Okay, so that affects like swallowing and everything. It makes it very painful to swallow, and you do not want that. Whenever a drug is made, it comes with a manual of instructions which we are supposed to adhere to. So you can't go and chew a tablet unless the tablet is a chewable tablet. Some pills are produced in a certain way to protect the human body from like harmful irritants. So you have some pills that are enteric coated. That means that it's been coated with a substance to protect the medication from the acidity of the stomach, so that it can be absorbed for you to get the benefit of the medication. Some of them too are designed in the way that it's released bit by bit. So those are the medications you see written LA, XR, XL. These are all delayed release medications. You cannot chew those medications on no circumstance at all. When you do that, it just breaks down the whole system, because for the delayed release, that means that it's supposed to be released in your body bit by bit at certain intervals, at certain times. So if you are chewing that tablet, that means that everything is going to be released to your bloodstream, and that can lead to toxicity depending on other factors that may be present. Okay, so you cannot chew any medication under no circumstance unless it's a chewable medication, unless the pack says chew me, don't chew. I know some customers that will come and say that unless I chew the medication, it won't work. Please use your mind, it will work. Try it and see. I will forever talk about this point. I do not understand patients when they take capsules and put the powder on their sores. I don't even know where this thing came from. So I actually asked my grandma, and she was like, back then they didn't have antibiotic creams and ointments, so they were forced to use those means. But in this 21st century, we have so many antibiotic creams available. Please use them and stop using the capsule. Apart from the fact that pouring the powder on your sore can cause skin damage, capsule was formulated to be ingested, okay, not to be applied topically, not be applied on the surface on the skin. There are mechanisms that you need for a powder to be absorbed into your system, and it doesn't come with the capsules. And if you have a bacterial infection, the bacterial infection can spread to other parts of your body, and the powder is just acting at one site. Okay, so you might be putting the powder on your sore thinking that it's healing. It might heal on the surface, but it doesn't necessarily mean that inwards the bacteria hasn't spread. Okay, because the creams will work faster and better than the powder. So please stop using capsules, opening them and putting the powder on your sore. Just get an antibiotic cream or ointment. First of all, not all medications are supposed to be split. If it's supposed to be split, it will be stated on the manual that this medication can be split. Some medications that can be split have a line in between them to facilitate the splitting, and it's called a scored tablet. Those ones can be split. For patients with chronic disease such as hypertension, diabetes, you might have to split a tablet or two. So in this instance, don't split all your tablets. Let's say if you bought 14 tablets, don't split all the 14 tablets at a go and put them in your leaflet or your container. Instead, split one tablet and then make sure you finish using that before you split the next tablet. Okay, because once a medication is split, it opens it up to humidity, heat, and other factors that can cause degradation. And imagine you have that tablet and you didn't store it well for like 2 or 3 months before you actually take the tablet. Likelihood of that tablet being less effective is actually very high. Please talk to your personal pharmacist to help you obtain a pill cutter to help facilitate the splitting. Thank you so much for watching this video. I'll see you next time. Bye.